Hi, Amy Wheeler here, helping you to assess the hip for yoga therapy. All right, so let's have you face this direction. We've got 6 different directions of the hip. The first one is going to be flexion, just lifting the thigh up, lifting the knee up. Now he's also got flexion of the knee, but that's not what we're looking at right now. We're only looking at the flexion of the hip. Any pain there?
A little bit of soreness and ache here.
Little sore achiness right here. All right, take note of that. We found that before when we were doing some spinal stuff. Go ahead and come down. Now, without letting your torso come too far forward, I just want to see your hip extension straight back and tell me if you feel anything. He's got pretty good extension through the whole front here, but do you feel any pinchiness or pain back here?
No.
Good. A lot of people, when they do hip extension, everything gets kind of compressed and congested in their hip and low back, and it hurts. He feels pretty good. Let's have you turn around, and I want to do the same thing with the other leg. So let's go with hip flexion, and I wouldn't mind if his leg was bent or straight because we're not looking at the knee. It's just easier when it's bent. So any pain with hip flexion?
No.
All right, hip extension. Any pain in your low back or your hip, anything on this side with extension? Good. All right. Wonderful. All right. Now facing the camera, we're going to have him do abduction, which basically means he's moving the legs away from the midline. So I'm just going to have him lift his right leg out to the side and tell me, do you feel any pain, any sensation, uncomfortable feelings?
No.
Okay, go ahead and lower that down, and we'll do the same thing. I don't know if you need another chair. How does that abduction feel of the hip?
Good.
It's okay?
Yeah.
All right, adduction, moving to the midline. What happens if you take your leg and cross it over the midline? Wondering if he feels any tension in through here.
No.
Okay, good. Other side.
No.
No problem. All right. So just note, when we're going out, he's using these muscles. When we're going across, adduction, he's using these. So in this way, we're kind of checking out these guys, and in this way, we're checking out these guys. Awesome. All right, last one. It's a little bit subtle, hard to see, but can you, without doing your knee and your foot, can you internally rotate your femur? Just taking your femur in the hip socket and internally rotate it. Any pain there?
No.
And can you do the same just without, your knee and your toes will come along, but can you from the hip externally rotate that hip? Is that okay?
Mm-hmm.
No pain?
No.
So when he does the internal rotation, he's using these muscles. When he does the external rotation, we're checking these muscles back here. These muscles externally rotate your hip. No problem on the right? Let's try with the left. Internal rotation. There you go. Any pain in through the pelvis area?
No.
Pinching? Nope. Okay. External rotation. Beautiful. No problem?
No.
All right. So his hips, except for one little spot, are in pretty good shape. He's got good flexion, extension, abduction, adduction, internal rotation, external rotation. We do have a little bit to work on with the hip, but nothing really major going on in the hips, which is a very good thing.